Welcome, everyone. My name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today. And our speaker today is Allie Hunter. Allie is from the Henry Ford Health System, and she's going to be talking to us about customer technical support. Before I hand things over to Allie, just a couple of housekeeping items. We ask that you use the Q&A function in the bottom of your Zoom window to ask questions, and only use the chat button when you have technical issues. This will allow us to record or to keep track of all of the Q&A questions. So if there's something we can't cover during our time together today, we'll be able to get a hold of you and get an answer back to you. We are recording today's session. It will be posted on our UMTRC YouTube page, as well as on our website under archived webinars, and the slides will be also posted on our website. The video and slides will be posted within the next week. Give us a couple of days. We'll make sure to email those links and information out to everyone that is registered for today's session. So without further ado, Allie, I'm going to hand things over to you.
Awesome. Thank you so much, Becky. I really appreciate it. Welcome, everybody. As Becky said, my name is Allie Hunter. I am a virtual care consultant with Henry Ford Health System in the Detroit, Michigan area, and I am really excited to get to speak to you today about you can lead a horse to water, but what if they do not know how to drink? Customer technical support and virtual care. So I have three objectives today with my presentation. The first is to introduce technical customer communication, education, and support. The second is to provide a strategy template and considerations for customer technical support, both inbound and outbound. The third is to illustrate a real-life customer support journey through the eyes of an integrated health system, overviewing where we've been, where we are now, and where we're going. And then lastly, I think my ultimate goal is that you walk away from this presentation with just one new piece of knowledge for your own personal self, or to be able to take back to the table and to infuse it into strategy conversation, or maybe put in place in an operational workflow. So let's get started. I think it's really important to provide a little bit of some context of where a presenter is coming from and the organization in which they work at, because that way you can understand the lens in which the information is delivered. So I work at a relatively large institution. Henry Ford Health System at a glance has 5 acute care hospitals, 3 behavioral health hospitals, 30 medical centers, 1,600 plus employed physicians, and 20 Henry Ford physicians in our physician network, just to name a few statistics. And you can see on the right the area in which predominantly all of our facilities are located. We are a small but mighty team within our virtual care department. There are 7 of us total. We have 1 director, 1 manager of access care technology. We have 3 virtual care consultants, 1 analyst, and 1 instructional designer. And our mission as a department is to evolve innovative care delivery to enhance health and wellness through accessible technology that drives connection and collaboration when, where, and how it is needed most. We are focused on finding that right patient at the right time, using that right intervention with the right provider in the right place. So the meat of why we're here, let's get started with the need of customer technical support. And in order to do that, I think it's really important to highlight 3 specific definitions to get a better understanding and ground us. So the first one is health literacy, and you're likely familiar with this one, but it is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. If we expand upon that, we've got digital health literacy, which is defined as extends the health literacy definition to include the ability to appraise health information from electronic sources and apply the knowledge gained to addressing and solving a health problem. And then we've got this third one, and most of you are in the telemedicine space, likely, which is what has enticed you to join this presentation. So you may or may not be familiar with this one, but it is newer to the party, if you will. But it's telehealth literacy, and that's defined as the capacity to understand and have personal and technical comfort with the receipt of healthcare through technology. And I want to really focus on that word comfort because it's pretty ambiguous in this definition and it can mean a variety of different things depending on who you're speaking with. So, likely, if you're on this presentation, you relatively have a good understanding of your patient population. And I would assume and go out on a limb here to say that your patient population has a pretty wide breadth of comfort when it comes to telehealth literacy. And so it's really important to understand what that spectrum is because you can talk to one patient and they feel very comfortable with the platforms that you're using to access your telemedicine, telehealth platforms. Or you can talk to another patient and they are very anxious, they're nervous, they don't really have any familiarity, and it requires some additional education and resources so that they can adequately access these resources. And so I think it's really important to know what that comfort level is. And as we look at customer technical support, because once you know that, then you're able to meet your patients where they're at and deliver that support in a way that's going to resonate with them. So, why is customer technical support important? Well, let's make the case. So, the National Center for Education Statistics found that 16% of US adults are not digitally literate. And these adults that fall into this category are, on average, less educated, they're older, and they're most likely Black, Hispanic, or born outside of the US. We also know that patient facing apps have poor usability for populations with limited health literacy, and few digital health tools explicitly consider digital literacy, health literacy, age, and English proficiency in their design when they're making it. And I want to focus to the right, this screenshot that I have on here. This is a screenshot of one of our patient facing support tip sheets for our video visits, our scheduled video visits. And you can see that we've translated it into Spanish, which is one of our popular languages outside of the English language for our primary population with our patients. And I want to focus on that yellow area that's highlighted specifically in step number 2 and step number 3. And so while we have translated these materials into Spanish, you can see in bold, the prompt is actually still in English. And if we go to the photo that accompanies that step, we can see that the photo, all of the navigations are still in English. And so it's important to note that because even though the tip sheet is translated into a different language, the prompt is still in English. And so a way to mitigate that so that patients still knew what they were selecting is that we put the translated word in parentheses next to that English prompt. And I can't take credit for that. That was actually doing some analysis of other health systems, and we stumbled upon that with UNC Chapel Hill's education tip sheets, and we thought that was something that a really great a nugget of brilliance, I should say, to steal. But my chart does offer the option to change into Spanish. We just haven't, as a health system, been able to turn that on quite yet because it's not as simple as flipping a switch. And to do that, there's all these other elements that need to be taken into consideration. It doesn't automate all of everything that's aligned with our settings to be able to translate it. And so you can see that while we've taken the step to translate these materials into Spanish, still the platform itself is in English. And so there's a little bit of a gap there that we as a health system are still missing to be able to support that patient population. I like to add a little bit of levity to my conversation when I'm And I think Dilbert, I swear, Scott Adams, who is the creator of Dilbert, he must be picking the brains of those in telemedicine. And so this comic says from Dilbert, your user requirements include 400 features. Do you realize that no human would be able to use a product with that level of complexity? And then the man says, good point. I'd better add easy to use to the list, making it 401 features. And so hopefully that gives you a little bit of chuckle. Since this is virtual, I'm assuming that you're sitting behind your computer and at least smiling to that one, because I know that we need to make sure that what we are entrusting our patients to be using is easy, and we can assist them in getting situated with it and understanding and accessing it to get the care that they need. But we wanted to find it to be as simple as possible. So that's a little bit of the laugh, hopefully, that it gives you this afternoon. So what are some of these common technical issues and patient education things that we find that we run into? And I'll preface this slide with knowing that this is kind of more specific to us as a health system. So some of these might resonate with you in your health system. Others might not be as prevalent, but the way in which we designed this was that we have, you have the patient issues up at the top, and then they funnel down into 3 areas of the video visit experience. You've got before on the left, you've got during that video visit in the middle, and then you have after on the right-hand side. And so specifically for this presentation, wanting to focus on that left bucket of before. And some of the things that we know that our patients have run into are they are not active in their patient portal. They need to be activated. Or perhaps they have an inappropriate device or equipment that does not work well with the platform that we're looking to use. Maybe they have difficulty downloading the apps. I know we've got plenty of patients that don't know how. They didn't know they needed to download an app. So there's that gap in education. Perhaps they're unsure of how to find or access the video visit once they've logged into the patient portal, or even finding it on maybe a calendar invite. Or they've selected that incorrect telemedicine functionality. I know for us, we've got patients who sometimes get confused with selecting that on demand versus a scheduled video visit versus our e-visit, and not understanding the differences, as well as unsure of where to access those instructions. Or maybe, like I just showed you, the instructions are not in their preferred language. So those are kind of the areas where we're finding common technical support. In addition to during, you've got your audio only, video only, or maybe both, some of those really complex technical issues that patients are running into and they're needing some assistance or help. So we've level set with the 3 definitions, understanding what telehealth literacy is and the importance of understanding your patient's level of comfort. We've laid out the groundwork and foundation to show that it's needed, that patient health literacy is really not taken into consideration, and we have an understanding of what some of these technical issues tend to be. We also know that most health systems don't provide training or adequate teaching to the populations on how to use these tools. And this actually has shown to be an effective approach for ensuring adoption of digital health tools. And I want to focus on this image that I have on the slide, where this is specifically a question was asked to what is commonly for us, we have a patient facing advisory group. So it's an advisory group made up of patients that give us feedback on things or initiatives that we're looking at rolling out, so that we're not missing a lens to be able to roll it out effectively. But the question that patients were asked here were, when making an appointment for a virtual healthcare visit at ABC Health, how useful would a call from a technology concierge be to ensure you understood how to use your iPhone, tablet, or computer prior to your scheduled visit? And a resounding 66% of respondents stated that a call from technology concierge would either be extremely or very useful when making an appointment for virtual care health visit at their specific healthcare provider. So we know that patients want it. So now that we know that, let's look at some of the inbound and outbound strategy considerations. And before I dive into again, want to preface the fact that these all might not resonate with you. I'm assuming that we've got a breadth of people from different size organizations. Again, I'm coming from a larger organization. So if this doesn't seem like it's feasible, my hope is that, and my ask, or I would challenge you to look at these and say, how can I adjust this or tweak this so that it does resonate with my organization? Or maybe you take 2 of the 7 things that make sense for your organization, depending on the size or the structure and what you have laid out for your telemedicine department or your virtual care department. So, from a strategy standpoint, if we're looking at inbound short term considerations, the first thing to focus on is define a technical support purpose and functionality, past and future, of your contact center advocates who are handling this type of support. So, really get clear on what their purpose and functionality is, because before you dive, you don't want to dive into and get ahead of yourself if you don't even know what the purpose and functionality of this support work would be for inbound calls, inbound support. Then create a comprehensive training for contact center advocates on basic technical troubleshooting and consulting your telemedicine team, if you have one, on what should be included. So work with that telemedicine team to outline a training that would be comprehensive and effective for these contact center advocates that are answering these types of calls. Or if it's not a contact center, if it's just one person within a clinic or at your organization, what are some of those things that are important for them to know and have basic training on, as well as basic technical troubleshooting, some things that they can mitigate and help which are within their level of knowledge and expertise. Then define escalation process for inbound patient technical support calls in the contact center or wherever these calls might be coming, so that if it does go beyond that knowledge, that basic technical troubleshooting, you have a solution or a person or a place to send the patient to if it's an extensive technical issue where they need additional handholding and support that isn't typically provided by these frontline individuals. The fourth one we have here is ensuring customer relationship management, or your CRM, is built out with the following considerations: that there's a section specific to advocates fielding these inbound calls, because you want to ensure that they are tracking. So you have easy access to patient facing virtual care education, searchability, etc. What this one really means, and we're expanding on, is that they have access to those tip sheets that are created so that they can help walk a patient through, or maybe they can send it in a follow-up email. There's easy things that it's easy to search for any of the type of topics. Maybe it's an uncommon thing that the patient is calling in about, but they can find it very quickly. And then see what I had mentioned of that robust tracking of virtual care issues to inform strategy and solutions, so that you're able to refer back to it, to assess and analyze on a regular basis to see what are the common issues that are being called in about, how do you better support your platform, where are the gaps and barriers that you're still missing, and laying that out from a strategy standpoint. Is there any low-hanging fruit that you can really get to easily? Or if it's a long-term goal or item, where does that fall on the timeline? The fifth one we have here is create a process for onboarding new functionalities and updates that support patient education, self-service options, and then also access to patient-facing virtual care education, such as searchability, targeted placement on the website, making sure that it's above the fold, not below, ensuring that they don't have to scroll too long or search too hard. Patients really would like this to be served to them on a platter. They want it to be easy. If it's not easy, if they're spending lots of time on your web page trying to figure out, or even on the instructions, they're going to get frustrated and they're not going to want to use it. The sixth one we have here is that organization-wide communication of purpose and scope of contact center advocates and or whomever would be fielding these types of calls and support. or those who are providing it. So what I mean by this one is specifically when and how to send a customer to these resources and what needs they support. So again, if you go back to that number one, if you're clear on that purpose and functionality, this one should be a walk in the park. You should be able to clearly articulate what's the function, both internally, so people are clearly passing patients on, that it makes sense, the right need for the patient is being sent to this person, these contact center advocates, or whomever is going to be fielding these questions, and it's clear what they support, so everybody doesn't have any questions of, I think maybe they do, I'm not sure. And then lastly, if this doesn't exist in your organization, creating that job description, making clear staffing structure, having compensation, and conducting hiring for these roles. So maybe you do have these roles, and these are, 1 through 6 are just things to help restructure. But if you don't, number 7 is going to be prevalent in how how you're conducting that job description, how you're hiring for this type of role for any inbound person who is going to be supporting these customer technical needs. So we'll switch to outbound. So outbound being reaching out to patients, any type of support where you're calling the patient. And so the first one we have here is embed virtual care in your RN or MA onboarding and skills fair, or whomever may be conducting outreach to patients. So I put RN and MA because I know within our health system that a lot of these individuals in these roles are the ones that are touching the patient prior to the visit, whether that's 10 to 15 minutes prior, or sometimes it is 24 to 48 hours. But something that we've done as an organization is that from the get-go, we are onboarding any new staff from an RN or MA, they are getting this type of training. So it's not, so it's something that they're very familiar with from the start of their career with the organization. Then I would say create a workflow process for outreach to patients 24 to 48 hours prior to the appointment. I'll go into detail in the next slide of what a sample workflow might look like, some sample considerations if you don't have anything in place already. Create a call flow process to support staff to follow when conducting outreach to patients. Again, I'll go into some detail about what the call flow process should look like. There is a method to the madness. There's importance of why you should ask certain questions before others, because it helps flow the conversation flow and allows the patient to get set up appropriately. If you have this, I would also recommend utilizing or creating smart phrases within your EMR for uniform instructions to be sent via patient portal messaging functionality. Again, if this applies to your organization, this just helps for a more streamlined approach. You know that the patients are getting all getting the consistent, same, up-to-date instructions, and then it makes it easier for those who are supporting this work in real time, who are on the front lines conducting this, so that they don't have to be typing this out new day after day, patient after patient. Provide easy access to patient-facing education tip sheets, instructional videos, and translated materials to be sent to patients. So we have something on our intranet within our health system. We have a page ourselves, and we try to have our updated materials that are housed online and updated on a consistent basis. It's a link, so that way when we do update them, the link is just updated, so it's not an outdated PDF. We're not sending old PDFs, or people aren't working off of old PDFs. Additionally, this just makes it very clear cut of where to find it, and it's a consistent place for people within your organization to be able to go to one spot to know that they're getting the most up-to-date information to be able to send to the patient. And then the last one I have here are consider building additional functionalities within your EMR to optimize your outreach process. So for us, we have officially finalized all of our build with our video visit technical risk score that we have taken from Johns Hopkins, and we've refined it so that it's unique to our organization. We also offer on-demand texting so that a patient either knows that somebody's going to be calling them to go through their instructions, or letting them know if a provider is running behind. Our direct join link, so if a patient is having so much technical technical difficulty themselves, that they really just can't log in, a provider can just click on the direct join link and send it to the patient, making it a more easier experience for them to get onto the appointment. And then not yet patient. We recognize that having a patient my chart or within our patient portal is a barrier for some patients. And so having this not yet patient option is an easy way for them to create an MRN, and get within our system to be able to schedule those scheduled video visits as well as conduct an on-demand video visit. So I mentioned that's a workflow for calling 24 to 48 hours. And here are this is a sample one, but some considerations that I would recommend are identify your patients with new appointments or criteria used to determine necessary outreach. So maybe new appointments is not the criteria that you would recommend using. You might know, depending on the specialty or the service line, it might be better to have different criteria, such as, you found that you need to convert more of your existing appointments, so your return appointments over that they need additional support. So whatever that criteria might be, identify what that is so you can determine who you're doing your outreach to. Then we would recommend calling that patient 24 to 48 hours prior to the appointment. From there, sending that SMS to the patient indicating that they would receive an appointment preparation call from your organization. And then this just helps for the patient to pick up on that first call of whomever is doing this outbound outreach to the patient, so that they're not having to call back, leave a voicemail. Hopefully they call, once they call the second time, that the patient answers. The fourth thing we have here is walk through that call flow checklist, which I'm going to go over next. And then documenting the outcome of the telephone encounter in the patient's chart. So we know if the patient was reached and the instructions were gone over and it was a successful conversation, or if we know that you left a voicemail for the patient, but you're going to try to call back. Or perhaps you've identified through conversation that this patient is not best suited for a video visit. You've troubleshooted and you've triaged as best as you can, and you've come to the conclusion that the patient is not ready or does not have the appropriate device or equipment to be able to conduct it. So you are recommending that it be converted to maybe a telephone visit or perhaps an in-person. Or you've also, with speaking to the patient, something's changed in their schedule. And so now they're no longer able to have the appointment. And so you're able to either reschedule or have reach out to somebody, which is step number 6, providing a feedback loop to identify the stakeholder if the resource determines that the patient either doesn't have that appropriate equipment or can no longer conduct the appointment on the date and time in which they're scheduled. For that call flow checklist that I was mentioning, on the right, we have the actual flow of which we do, and this is these are a template of verbiage that somebody can use to make it flow. It's just a script, so our resources don't necessarily have to use it, but they can go off of it if they need it. But we recommend first confirming that they are active in their patient portal if this applies to your organization, and that they know their username and the knowledge of the password. If not, then you're going to be helping them reset their password and so that they can log into the patient portal. Next, determining the type of device being used for the video visit, specifically making sure they've got that camera and that microphone, making sure that they're using an appropriate browser if you know that a browser does not work with your platform. If they are using a mobile device, ensuring that the proper apps are downloaded if needed. A lot of people I know get stuck at the part of, I don't remember my Apple ID and password. And of course, that's not something that we as a health system are able to help with, but it's important to at least get them thinking about that so that they're not panicking that 10 minutes before their appointment. Making sure that they understand how to navigate in the patient portal, whether that's via the app version or the web version, to that scheduled video visit, so they don't get confused or get in line for an on-demand or the wrong place. And then providing some troubleshooting tips and a number to call for any day of issues. That way that first, hopefully, they can try to mitigate their issue themselves. And then if they've done their due diligence and they're still having issues, they at least know who to call and they're not calling these resources back that would otherwise be tied up doing something else. And then lastly, follow up with the patient message with links and tip sheets of covering everything that somebody has spoken with them on that call for the outbound call. Some overall considerations that I would recommend as well are forming an oversight committee of this work that involves cross-functional roles across your organization. And this is not necessarily an exhaustive list. This is also a list that is relevant to our organization. If you don't have these, that's okay. But really just kind of the point of this is getting your brain thinking of who would be best suited to be in this type of oversight committee. But considering telemedicine department, maybe your patient access operations, IT, the contact center, patient experience, marketing, your virtual care department as well. Take inventory of all patient-facing education materials and assess and identify your gaps. So some questions that you should be asking yourself when you're looking at all of your patient education are your materials easy to access? So I talked about, are they above the fold? Is it clear where to go once they've gotten to your main web page of how to find a tip sheet? Have your materials, if possible, been reviewed by a patient education team and or patient advisors? So if you have a patient-facing advisory council, to ensure digital literacy level. Those are just a few to name. If you have something else or there's another resource that exists, those are great to utilize as well. Do you provide translated materials, and do you know the top 2 languages at most that are not English speaking that your patient population tends to speak? And so are your materials translated into those languages so that you're providing an equitable experience for all of your patient population? And then do you offer closed captions on your instructional videos for the deaf or hard of hearing? Again, how are you being equitable in your patient education and your materials that you're providing? And what are some of those gaps that you can identify initially? And are individuals who don't look like you, who don't have the same abilities as you, reviewing these to help you find some of those gaps? And then lastly, determine how to approach operational stakeholders for awareness of this initiative and these strategies, the value proposition of why is this work important? I know sometimes can be the biggest rub because sometimes there's dollars associated with this type of support work, but there is a strong need from the patient population. And at the beginning of this presentation, we laid out that for why. And then who is going to be executing the work? So again, that they know that who to refer patients to, how they can talk about this in other specialty or service line or operational meetings, and people know who to go to. So if we look at us as an organization for past, present, and future states as Henry Ford, just to give you a high-level overview of where we've been, previously we were really focused on, as I'm sure many of you were, the adoption of the technology by providers and patients. Versus just it being rolled out. I think COVID obviously expedited telemedicine and virtual care being at the forefront. And so some of those pain points that we were just begging people to use it have now gone away because of the rapid adoption. Our patient education materials were only offered in English. And so this year we were able to update those to be translated into Spanish and Arabic, which are our top 2 languages. We had limited to no outreach to help the patients be set up for the video visit. And again, this was likely because adoption was low, but even when adoption skyrocketed, we really didn't have these resources in place. And so, as I'm sure, along with many other organizations, this was a big rub for us. We didn't have any formal centralized working group supporting the oversight of the strategy efforts. Me and our director, we oversee our customer technical support steering committee that meets on a monthly basis. And we have representation from a lot of those groups that I had made mention of in this previous slide. And we're just trying to keep on top of all of the initiatives that we've outlined in our short-term and long-term strategy goals. And then we had a contact center advocates who were pinch hitting and fielding technical calls from customers working off of tribal knowledge and self-taught tips. So there was no formal structure of training, no roles that were specifically designed for this type of work. And we desperately required data to prove the need for this type of work. And so we were really struggling, in order to use data, you have to have data. And so we were trying to figure out, how do we get this data? This is something that we were struggling with for quite some time. Where we are today, so we have developed that customer technical support committee, like I mentioned. In terms of getting that data, like I just mentioned, we conducted a pilot for patient outreach for new and return video visits within our orthopedics service line. And from June 2020 to May 2021, we had athletic trainers who were redeployed due to the COVID situation. We had them doing outreach to patients for that time period, and they were able to call almost 4,000 patients to do outreach to get them comfortable, up and running, and to some of those technical issues and that gap in patient education, which really, really helped us craft this narrative of the need for the support work that the system is looking to, provide for the patients. We are working with our operational stakeholders across the system to support outreach. Some of that looks like understanding how their workflow works and knowing that maybe a centralized outreach is not best suited for them. Maybe they have more local resources that are going to do this outreach. And so knowing that not, one size doesn't fit all because we are such a large organization. We've revised our patient education tools to include a dynamic instruction widget on henryford.com, which is the image that's on the right-hand side, and it walks them through a series of questions and prompts with some visual representation so that they know they're on the right track. Somebody gave me this term, but a confidence marker to ensure that they are following the steps and everything seems to be going along the lines of how it's supposed to. And then I made mention we translated our materials and we've embedded our virtual care into that RN and MA onboarding skills and skills fair. So where are we going? Two areas that we're focused on specifically in the future are patient-facing technical support strategy, which includes putting together our pre-test option. That actually is almost in a finalized draft, and we're looking forward to rolling that out shortly. Continuing to push and assess what proactive patient outreach looks like depending on the service line that we're working with. We have implemented, this is finalized, it's on both of our multi-provider schedule as well as our department appointment resource for our patient video visit technical risk score that's calculated in the EMR. We are currently working on hiring our dedicated technical advocate that would be then 24/7. And we're also starting to have conversations again about creating a genius bar or a tech squad type of environment for on-site technical support. In terms of education and engagement, we continue to leverage our patient-facing advisory council. Getting the voice of the patient is critical to ensure that we're not missing or making decisions in a vacuum. And that allows us to enhance those customer education materials and resources, as well as assessing and continuing to assess the digital and health literacy in virtual care within our patient population, working with groups that oversee diversity, equity, and inclusion, and making that a strong part of our strategy, as well as our alignment with population health and community wellness. We've started on some initiatives with those in our elder or older population to ensure how we can utilize some grant dollars to make them more educated on how to use their virtual care. So some final thoughts is, don't take it from me on the need for customer support technical, or excuse me, the need for customer technical support and the why. Take it from the patients. These are pulled from some of our Press Ganey patient satisfaction surveys that patients have explicitly called out. One being, I am quite new to the video appointment. However, I found it to be safe and convenient way of getting the assistance I needed. Additionally, the staff member who assisted me with downloading the app and everything else was very helpful. Another one said, Kim was very helpful explaining the process of hooking up the video visit, and tech support also as helpful the day of the visit, for I couldn't quite remember everything I was to do. And then lastly, was really nice that the day before the video visit, a rep helped walk my husband through quite a bit to be able to use the video. Great idea. So patients, we know that patients need this. We know that patients want this, and these are just great examples of their appreciation of when it is given to them. And so lastly, to wrap up my presentation, if you only took away 4 things, I would want you to take away these things. Number 1, your patients and customers will have a various degree of digital and telehealth literacy. Don't assume they don't need assistance or don't want to learn how to access virtual care options. And this goes for if you're working in operations or if you're working in clinical. I think oftentimes people make an assumption or there's some bias, and it's really important to continue to push this narrative that that's just simply not the case, and research does back that up. The second is creating robust inbound and outbound customer technical support strategies. Ensure you're meeting customers and patients where they're at. And that's really important because you can't expect them to just get to where they need to be. There is a portion of your population that's going to need assistance, and be doing what you can to be able to provide that for them. The third is optimization of this work is ever evolving, but it's important to start somewhere. You never fully arrive, and you're constantly reevaluating, you're constantly reassessing. I mean, I gave this presentation in July, and some of the comments that I've had on here have already changed, and we've evolved, and some of the things from our strategy we've made progress, which is exciting. And then lastly, patients and customers appreciate the outreach, and it has positive impacts on patient satisfaction scores, which we've seen, and virtual care visit outcomes, which makes a difference for both patient and providers and their desire to want to continue to use virtual care in the future. So thank you so much to everybody who is attended and it's joined me today. If you have any questions, I would love to take them, but also here is my information if you'd like to follow up in any other capacity.
Thank you so much, Allie. I really appreciate your knowledge in this. This has become a hot topic throughout the pandemic, and how do we deal with health literacy and really educating our patients to know what to expect. We have received a couple of questions.
Okay.
Do you use in-office visits to educate patients about virtual visits and then get them set up for success while they're in the office?
Yeah, great question. So I know that some of our specialties and clinics do. Again, not all. So it really just unfortunately depends on the provider and the clinic as well. But that's a great best practice because when you have the patient in person, it's much easier to walk them through. So if that's something that's feasible for you to do, we absolutely would recommend that as a best practice to be able to educate the patient in person before they do a virtual visit.
Okay. And then as a corollary to that question, do you try and identify those patients who would most benefit from virtual visits so that they are targeted for this education?
Absolutely. Again, I think that is a great best practice that typically comes down to clinics and knowing the providers and the support staff knowing the patients. And so, kind of made mention of making sure that bias, you're checking your bias to know that the patient, just because they might look a certain way, present a certain way, doesn't mean that they wouldn't be a great candidate for this type of care. If it's not being presented to them as an option, some patients don't even know that virtual visits are, feasible for their visit and their reason for a visit. So I absolutely think it's important to self-identify those patients that you might think would fall into that category, but also simply asking the question, are you familiar with this visit? The reason for our follow-up does qualify. Would you be interested in learning more? And then being able to connect them to a resource if they had any additional questions or there was some apprehension on getting set up.
I want to thank you again so much, not only for presenting for us today, but being part of our July conference that we were able to hold in person. Even though it was a small group, I think we all enjoyed it very much.
Oh, absolutely. Yeah. Thank you so much for asking me to present again, and to everybody who joined today. Like I said, if you have any other questions or you would like to reach out, please send me an email. Happy to converse.
All right. Well, thank you everyone for spending some time with us today, and have a great rest of your day.
Thank you.